Today we have Deborah Lane with us. She is a program specialist team lead for the National Rural Health Resource Center, also known as the Center. As a program specialist team lead, she provides education, coaching, and technical assistance to rural health networks on topics such as strategic planning, evaluation, collaboration, community engagement, partnership, and leadership. She utilizes her extensive background in training, facilitation, and presentation skills to assist rural health network leaders accomplish their goals. Today we'll be talking about care coordination and building a business plan. Take it away, Deborah.
All right, thank you. Well, as Ashley said, that I work with the National Rural Health Resource Center, and I really love my job there because the organization here focuses totally on helping communities like you're from improve their health care and sustain their health care. And I dearly love talking about care coordination because it's something that I have personally experienced, especially with my parents, and know the increased quality of life that good care coordination can have. And so that's an area that I've done a lot of learning and research in, and like I said, have experience in because of being a child of two parents that had various aspects of care coordination through time. A few questions as we start our time today. Is anyone on your staff or you talking about care management and how it fits into your hospital or your clinic and its bottom line? Are you talking about wanting to expand care coordination? Are your patient outcomes where you want them to be? Or perhaps you're wondering how this thing called care coordination really can affect the bottom line. You may be doing it because you know it's the right thing to do, but it does have an impact on that bottom line. And so today we're going to address the importance of care coordination as your hospitals and your clinics move into and further all the time into those value-based payments. We will look at how the foundational elements of an effective care coordination program will address these new payment models. Social determinants of health, chronic care conditions management, community care coordination, and emerging value-based payments will impact your bottom line. And if you're hearing that deep sound in the background, I'm in Duluth and there's a ship going through the ship canal blowing its horn. So I apologize for that extra noise. It's my hope today that we'll be able to, at the end of our time, really link care coordination to those value-based payments and to better patient outcomes and to lower that'll lower our costs and to introduce to you a tool that will help you establish a business model for your care coordination program. After the webinar, it's my hope that you will be able to recognize the importance of care coordination in value-based payments, examine how care coordination improves patients' outcomes and reduces your organizational costs, and know the elements of a successful care coordination program, also known as that care coordination canvas. So let's start with that value-based payment piece. First, the triple aim. Why does the triple aim matter? Well, you are likely to be very aware of the triple aim, maybe even the quadruple aim, all first trademarked by IHI. And then CMS identified its own quality strategy focusing on three aims, which are seen here in this slide. Better care, healthier people, healthier communities, and smarter spending. These aims equate to the value formula on your screen, where Quality is coupled with patient's experience, linking your HCAHPS to their perceived outcome, and divided by the cost of care, and that equates value. So the quality of care with the patient's outcomes, their perceived value of the quality of care divided by the cost equals that value. So when we hear and mention the term value-based care, it isn't only about finances. It isn't only about quality metrics or readmissions. It's the entire formula put together. The financial equation for healthcare organizations looks like this. The quality plus the experience divided by the cost, that triple aim, times your population, how many people you're serving, equals your value payment. When we look at the core of this equation, the quality plus the experience, it's increased by having a good, solid care coordination program. And really the bottom line here is that care coordination improves patients' health and reduces your organizational costs. Thus, care coordination in its purest form makes money for your organization. Now, I've shown you this visual before in this webinar series, but I feel like it's worth revisiting here again. This visual may be one of the best ways to describe what is truly happening or what has truly been happening in our healthcare industry. When I think back to entering into working with smaller hospitals, critical access hospitals, it was a payment system based on fee-for-service with very limited financial risk. And there were incentives to increase services provided. There was very limited communication between providers. And that's one of the pieces of care coordination that is so near and dear to me, is knowing how important it is to a caregiver of parents to have that communication going on instead of me being that conduit. That's just, to me, such an important piece that improves the quality of life for a person as well as their health. In that old value or volume model, there was limited focus on outcomes with no information sharing. And the only way I can say it is that care was really truly provided in silos. We're moving to the other side of that visual is to value. And value really focuses on high quality of care at a lower cost, focuses on best practices and evidence-based medicine. And instead of sick care, it really is well care, because that value piece focuses on prevention. And care coordination has a key role in improving communication. And there's an investment in clinical integration, population health, and innovative models. And I hear that from organizations like yours all the time, is the integration and looking at population health and how that affects things. And care is provided in medical communities versus these silos. When we look at all of the pieces on that value side, it's really the care coordination that takes and holds it together. Value-based payments are on a continuum of risk, ranging from the no longer feasible fee-for-service, where there is a high risk for payers and a low risk for providers, to that other side of total cost of care, which is high risk for the provider and low risk for the payer. In terms of value-based care, value-based payment, there's a variety of reimbursement strategies here. The accountable care organizations, there's bundled payments, there's MACRA and MIPS, There's the global budget. There's Medicaid and insurance company ACOs, and then there's the chart model. And I'd like to touch a bit on details of some of these and draw that connection to care coordination. The first two I'm going to talk about are considered demonstration projects, which means that certain healthcare organizations are receiving funding to try these ideas for, just try them on for size and see what the results are. And these are very well designed and closely controlled projects and studies. The most recent one was a number of organizations such as yours were coming together as a group to apply for the chart model or the Community Health Access Rural Transformation Model. And CMS aims to continue to address disparities by providing a way for rural communities to transform their healthcare delivery systems by leveraging innovative financial arrangements as well as operational and regulatory flexibilities. And this is all in that demonstration phase to see what happens. CHART aims to increase hospital financial stability and remove some regulatory barriers, and primarily to enhance access. Part of the chart model is the community transformation track. And in that track, it focuses on organizing communities, developing transformation plans, changing to capitated payments, include all payers, and semi-monthly payments to hospitals based on their previous cost. And care coordination is really a key element in this community transformation tract. Another demonstration grant that's been happening for about 2 years now, I believe it is the global budget. And in the global budget, this is just as in ACOs, the healthcare organization has attributed lives. And in the global budget, they receive X dollars for each patient. And these dollars are really to keep them healthy. So each healthcare organization receives a monthly payment of the same amount, so they know exactly what their cash flow is. And the healthier their attributed population is, the more dollars the healthcare organization gets to keep because of not spending it on care. So what is going to really make a difference in those attributed lives to stay healthier is really truly care coordination. ACOs have been with us for quite some time now, and I would guess most of you are part of one ACO and maybe have been through this time period parts of a couple different ones. But ACOs work to increase quality and reduce cost for patients as a group of healthcare providers have taken responsibility for. If you have any experience with an ACO, you've identified the most costly group of patients and worked toward increasing quality measures for them and improving their health. And that is, quite simply put, care coordination. Over the 7+ years of ACOs, they have learned some really good lessons. And if you look at these top 10 lessons, you see the #1 lesson is develop a care coordination program at that very top of the list. The Medicare Shared Savings Program is a permanent ACO program in traditional Medicare and provides financial incentives for meeting or exceeding savings targets and quality goals. The Medicare Shared Savings Plan program has multiple tracks that allow ACOs to choose between sharing in both savings and losses or just savings. And at the core, as you can see circled here, are the major functions of care coordination. According to the American Academy of Family Physicians, Care management and care coordination are key components in value-based systems. Yes, care coordination is at the center of value-based models, and having an effective care coordination program unlocks dollars for your healthcare organization. It is so important for us to remember that only 20% of a person's health is affected by the care we give within clinical walls. Our ultimate goal as a healthcare provider is to improve the quality of life and increase the length of life. But we need to consider all of those other things that affect a person's life. Part of the answer lies in addressing the social determinants of health. We've addressed the social determinants of health in other webinars, but it's a profound concept that deserves our time once again to review that definition. Social determinants of health are the conditions in which people are born, grow, live, work, and age. These circumstances are shaped by a set of forces beyond the control of the individual. These are things like economics and the distribution of money, power, social policies, politics at the global, national, state, and local levels. You remember that social determinants of health is at the foundation of that care coordination canvas. It's at the very bottom down there, and it's there because it is such a foundational element in coordinating care for people. Unmet social needs lead to things like nearly twice the rate of depression, a 60% higher prevalence of diabetes. And this isn't new news to any of you. I know I'm preaching to the choir here. There's more than double the rate of ED visits with those with increased social determinants of health needs. There's more than double the rate of missed medical appointments. All of these things cost your healthcare organization dollars. All of these things are impacted by care coordination. So being able to take and connect your patients with the needed services to help reduce or eliminate those social determinants of health really has a financial impact on your healthcare organization. It's said that 1 in 4 adults have 2 or more chronic conditions. And again, you're out there in the field, you know how many chronic conditions so many of your patients have. One of the income streams for care coordination is chronic care management, or referred to as CCM. And if you think back 2 months ago when Nadine and Cheryl were talking about how they and the organizations they work with use the Canvas, they both talked about the income that they were getting from CCM. And Cheryl also mentioned TCM, which is transitional care management. And one of the biggest messages that I've heard from those two through time is the importance for healthcare organizations not to leave those CCM and TCM dollars on the table. It takes many partners to meet the needs of your patients for both chronic care management and transitional care management. And we're going to talk in our last webinar next month about how to engage those partners with the care coordination that you do. I encourage you to visit RHI Hub and review the care coordination toolkit. One of the many things it addresses is sustainability. And the key factors in building capacity for sustainability include maintaining consistent leadership. And this is staff retention. That means you staying in your position long-term. Another piece of sustainability is forming an interdisciplinary team of staff. And that sounds like when we talk about a care team, we're talking about an interdisciplinary staff from the clinic, within the clinic walls, but also including persons from those organizations that can meet the social determinants of health. Establishing a strong and meaningful partnerships to meet those social determinants of health and the care outside of your clinic walls. We talked about this a little bit in our second and third webinars about social determinants of health and determining who those partners are, but we'll be really focusing on bringing those partners in next time. And another piece is securing stable funding through value-based payments, grants, fees, fee-for-service, being creative with the different ways that we bring income in and not leaving any dollars on the table. And finally, a big piece of sustainability is connecting with the community. In order for care coordination to be effective to meet the objectives of value-based payments and create a healthier population, you must have a solid workflow. The care coordination canvas assures that you have that workflow. And we went over this tool in detail in our first webinar. But just briefly to review the different components, there are 4 quadrants, with target population being the upper left-hand corner. And we need to know who we're working with, what our most needy, what our most costly population is. Is it the readmits to your emergency department with uncontrolled diabetes? Is it those with hypertension or COPD, or what combination? Just honing in on a target population to begin with, to get your workflows established and working well, and then you can expand to other populations beyond that. Now, as I mentioned before, your ACO might be suggesting who that target population might be. But again, it can't be like everybody over the age of 50 that you work with. It needs to be much narrower than that. Second quadrant is that of assessment, and assessing their social determinants of health, but also assessing what their clinical needs are and their disease state, and knowing how to track it, where to store it so it's accessible by all of those that work with the patient. The third quadrant is that of the care team. And those are both the clinical and non-clinical people that are going to help that person meet their health goals. And reaching for those social determinants of health within the clinical walls, you a lot of times can't do something about food insecurity besides refer them, or the transportation. But having those non-clinical partners on your care team, so you know what's happening and how to best serve them, is important. And the final quadrant is that of care team. And I was just talking about the care plan. The care plan is having those clinical outcomes as well as the social determinants of outcomes, and having it written down so the patient understands what it is and their caregivers understand what it is, having it in some kind of format so all of you in different clinical settings understand where it is. And then on to the care team that for some reason I mistakenly spoke previous, is to making sure that you have not only your clinical persons on there, but also those community-based persons that are going to make a difference, and establishing how you're going to be communicating. And remembering at the very base there are the social determinants of health, because that really undergirds everything that you're doing with your patients. And then right straight down the middle is collaboration, because we all do need to work together. Many aspects of your clinical organization, as well as collaborating with those outside of your hospital walls. A new tool that may be of interest to you is the Sustainable Community Care Coordination Guide. It takes you through a phased approach to look at your care coordination efforts from a business angle. Phase 1 ensures that care coordination is aligned with the mission and vision of your organization. And I'm guessing in almost 100% of cases, it is. This guide is written for both clinical and community-based organizations, and sometimes it really doesn't fit within the scope of some community-based organizations. Phase 2 aims to gain insight into how your care coordination program can be marketed and gain support of other organizations in your community and in your region. And phase 3 guides you in documenting your infrastructure and your operations of your healthcare organization's care coordination program, along with figuring out some of the financial elements. As I mentioned, the guide is written for two audiences, community-based organizations and healthcare organizations. And so there's parts of the guide that you would see the community-based symbol by, and that's meant especially for community-based members. And then there is the symbol for healthcare organizations as well. And there's many places that the pieces of the guide apply to both. It includes a workbook for each of you to keep notes on as you work your way through the guide towards sustainability. Now, I talked about Cheryl particularly, I know, talking very strongly about not leaving money on the table. And this is one of the nice pieces of this Sustainable Community Care Coordination Guide, is that Appendix C, it lists a number of potential care coordination revenue sources for your healthcare organization. And it includes things such as your initial preventative physical exam, annual wellness visits, preventative health screenings, depression screenings, alcohol and drug screenings, alcohol and substance use assessments and interventions, tobacco use counseling, advanced care planning, chronic care management, transitional care management, of which we've already talked about, diabetes self-management education, diabetes self-management training, integrated behavioral health components, remote patient monitoring, and telehealth originating site from your facility, and then also dollars for working with those that have a BMI above normal. These are some of the key resources for you to follow up with when you get the recording of the webinar, along with the PowerPoint here. All of the links are live. I really encourage you to browse and look through some of these resources, and they include a guide, a webinar, and a toolkit and a resource collection that will allow you to drill down and be specific with your particular organization. As we've reviewed the various pieces of value-based payments, I'm sure you recognize the importance of care coordination. And remember that there is a connection between how care coordination improves patients' health outcomes and reducing your organizational costs, which equates to a higher value-based payment. To accomplish these two, we have to have a successful care coordination program with all of those elements of the canvas. I encourage you to join me next Wednesday, August 3rd. Bring some of your questions and we can talk through with each other how to work with that sustainable care coordination tool, as well as just get feedback from each other on what kinds of income streams and some business plans that you may have for your organization. With that, I would like to open it up for any comments or questions. Each of our situations is so unique and we're at different places for the development of our care coordination program. We all are in different kinds of value-based payment models. So I'm hoping that this is a level that you can take and understand some basics and then drill down where you need to. So, well, through time, when I started working with care coordination, many organizations were doing it because it was the right thing to do. But as time has gone on, there are definitely business plans or business models for effective care coordination. But it's still the right thing to do.
Yeah. You know, my father had a cardiac event, and going to the hospital and doing his follow-up, you know, post ER, my parents were just amazed that they were told, okay, the care coordinator will contact you. She'll set up all of your appointments. She's going to call you every week or every 2 weeks to check in on your status and that you're following all your steps. And it was like a weight lifted off their shoulders because it was one less thing that they had to worry about.
Yep.
So it just makes them, one, reinforce that they've chosen the right care provider, that they're going to continue going back to that provider as well.
A very great presentation. This is Jody. The open office hours that we have coming up, can we stick that in the chat box too? And some ideas for using that session. It's a free session and some ideas that you can provide for people to think about in the next week. Would they want to show up for the call, bring a few people if they have questions, or team? How best to use that? What are some things you've seen so far?
One thing would be if Ashley has put the Sustainable Community Care Coordination Guide in the chat box, that would, taking some time and looking through those elements and the workbook and asking questions about how to use it. It's a little different approach than we often think of by really taking and diving into a number of our pieces of, you know, who could we potentially market to, who could benefit from it, looking a little bit at some fee-for-service kind of things, as well as those things that insurance companies might pay for, whether it be CMS or private insurance payers. So taking some time and perusing through that. Also, I have an understanding of value-based payments, but not super deep with all of the intricate ins and outs of those different payments. So not necessarily, you know, diving more into some of the details there we can do that together and looking up some information there if you do have some specific examples. And then just, you know, where is your organization at? The sustainability guide will help you talk with administrators about the benefits of care coordination and why to expand a program. It'll help you put the wording together. We can talk through that. Let's see. If you've got any questions from past webinars too, we can take and address some of those things. Is that all making sense, Jody?
Yes, it does. Absolutely. Any feedback from anybody else? we have a quiet group today. We did have over 23 people on, so I know there's lots of people thinking about this, and it's okay to just gather the information today and be making a plan and know that we do have another spot available, and we'd love for all of you to take advantage of that. So even if it's that you log on and you have one question to ask, please do. So, yep, thank you.